Hey guys, we hope you're all staying safe and we miss your beautiful faces. So, the article we had was the Appalachia Community Cancer Network Issues and Challenges in Evaluation by myself, Monique, and Chris. Moving to next slide. The ACCN was initiated in 2005 with funding from the National Cancer Institution, and NCI remains the primary funding source. The catchment areas included states of Kentucky, Ohio, Pennsylvania, New York, West Virginia, and Virginia. Researchers affiliated with the University of Connecticut, West Virginia University, Penn State University, Ohio State University, and Virginia Polytechnic Institution. The four objectives were to develop and maintain community partnerships with research and action and reducing cancer health disparities. Conduct research to guide local and regional interventions to improve program effectiveness. Develop, implement, and evaluate pilot research projects. There was a focus on cancer prevention and recruitments to clinical trials, and also train more researchers. Moving to next slide. What are some of the characteristics of the Appalachia region? Take a few seconds to look at pages 507 and 508 to locate that information. These regions included characteristics of high poverty rates, low educational achievement, limited access to health care, limited access to public transportation, also health insurance coverage, geographic isolation, high cancer mortality rates, greater than other U.S. regions, reported of high cases of lung, colon, and cervical cancer. Moving to next slide. What are some of the community impressions of the ACCN? Could these provide possible explanations for the high rates of cancer experienced in these regions? You guys take a few seconds to look at pages 507 and 508 for that information. Moving to next slide. Community impressions of distrusting medical services, a low belief in treatment effectiveness, diagnosis stigmas, denial of diagnosis, fear of cancer, low interest and resistance to health prevention instead of contacting medical professionals when ill or injured, cultural beliefs and groupthink, creating barriers and challenges that interfered with recruitment and program evaluation in general. Moving to next slide. What role do the principal investigators, aka PI, play within the ACCN? You guys take a few seconds to look at pages 507 to 512 to locate that information. Moving to the next slide. Program evaluation included 5 regions, also 5 PIs. Again, the University of Connecticut, West Virginia University, Penn State University, Ohio State University, and Virginia Polytechnic Institution were where the researchers affiliated within the universities. The headquarters also were the University of Connecticut. So there was development and maintaining community partnerships, conduct community-based research, recruitment for clinical trials, train researchers, additional program evaluation objectives, which included processes, short-term impact, and objective achievement. Moving to next slide. So what are some general considerations when designing program evaluation studies? Again, you guys, take a few seconds to look at pages 508 to 510, and you will definitely find that information there. Moving to next slide. Evaluation study considerations. were applied through application, immediate program effectiveness, and theoretical understanding. The resources were money or funding. There was time frame, knowledgeable professionals as the researchers, research methods, which included quantitative and qualitative, external validity, limiting evaluation studies, less control of variables, and consistent protocols. Moving to the next slide. So you guys, what are some general challenges faced by evaluators with program evaluation studies? You guys can look at pages 508 through 510 to locate that information. So the challenges were following rigorous techniques. There was treatment programs that were poorly designed. The comparison and control group, there wasn't one. Evaluators didn't help design the program. And in general, it was more challenging. Inconsistent protocols with assigning participants, researchers not trained. We also have the participant level, which there was fears of clinical trials, how results would be applied, effects on individuals' future treatment, and of course the isolation of populations such as minorities, which we have less participation, and there was also limitations on the sampling. Moving to next slide. There was staff manipulations, disagreement over the protocol, the treatment time, longer treatment times for one group, and more effort in manipulating program effectiveness. Also, in regards to the treatment fidelity, just sticking to the treatment model. The larger the program, the more chances for inconsistent treatment. And of course, evaluator bias. Wanting the program to be effective, potentially skewing the results, and interpretations of qualitative data. Greater attention to certain demographics over others, which is the level or quality of care. Moving to next slide.
All right, y'all. So what are some of the additional specific challenges faced by PIs when evaluating the ACCN program? So think that over with your friends, pause the video. So some of these challenges that they identified were it's a large endeavor. There's a large catchment zone, and there was often difficulty in kind of coalescing the PI's planning and the staff and the program's planning, and they often didn't kind of mesh together. And then there were misunderstood roles at all of the different levels, the program staff, the researchers, the volunteers that participated in the study. And then looking at unanticipated population variation. There's a wide-ranging number of risk factors and different types of cancer and how those risk factors impact individuals, and the type of cancer that they develop can be difficult to understand. Uncertain evaluation methodologies. There's a long time frame to measure outcomes, especially when you're dealing with cancer research, which makes causation difficult to determine, and kind of makes things more challenging. And then evaluating the objectives of the study, defining things, putting things, operationalizing things, and trying to understand develop psychometric measures to measure these things. Some additional evaluation challenges. A lot of the evaluation parameters are difficult to control, and a lot of volunteer staff would just not show up. They wouldn't. There's no accountability. They often lack the responsibility of being there, as well as measuring the cultural sensitivity of the staff. As far as the project variability, there are different types of cancers at different regions. Even though it's all the Appalachia region, there's different staff and there's different protocol, which makes this evaluation more challenging. Then the program evolving over time and there being inconsistent protocol and how you adapt to those changes and the effects both on the program itself and its overall effectiveness and all the other things that we evaluate, as well as the generalizability. And then looking at the types of programs that were kind of employed, you have the prevention, which was education, different screening things, and then clinical interventions as well. So further, we have some evaluation challenges. Communication, when people are distant from one another, when they're separate from one another, it makes that informal communication difficult to obtain when you're passing people in the halls. It's sometimes the question is important, even though it's not that big of a question. So it impacts collaboration. It reduces communication. It interferes with problem solving on the spot. It interferes with planning. It interferes with all these things, and especially with application. When everyone's not on the same page, then things kind of become more difficult. Some other challenges: types of contact. They had face-to-face contact. They had email, phone contact. They would do have team meetings occasionally, with conference calls a little more frequently. They were used primarily by the study or by the evaluation individuals. And there was this line item kind of list of things that they wanted to talk about, and often research was included on that. It's just when you have such a few number of conference calls, it makes that kind of evaluation a little more challenging. So some further evaluation challenges: the funding sources, obtaining enough funding to obtain adequate staff, accounting for turnover, layoffs, and how that increases the amount of training and decreases the consistency and validity and reliability of the study because there are new people now taking those positions. And then stipulations put in place by the funders, by the funding sources. There were different funding sources across the ACCN program, and a lot of times there would be slightly different things that were required. So there was inconsistent research that was conducted, and different sub-goals and objectives underneath those 4 primary goals that we talked about earlier. Then you have state-based stipulations. There really was no master plan. Each of the locations would kind of take things. They had a little bit of autonomy to do whatever they wanted, which, despite ACCN's encouraging cohesion, collaboration, and consistency there, it did change development, screening, evaluation, and training that occurred. So evaluator goal: increase generalizability, obviously, as well as determine the effectiveness of the programs, the efficiency, all those different things that evaluation studies really point out. All right, so further evaluation challenges: we have training inconsistencies and the ACCN network-wide mutual agreement. Despite this, and the agreements use this web-based cancer control training called Planet, and how there were live trainings associated with that in person, as well as webinar-based trainings, which kind of presents different instructors, different teaching styles, different ways of doing things. And when you have different people training different people, it reduces that consistency there that you need to really kind of reduce limitations within your study. So it also decreases the rigor, it decreases generalizability. Further, the ACCN didn't really know how to evaluate the effectiveness of the training. They ran into some problems there with developing those measures. And when they did have some sort of measures, not everybody supplied that data, which made outcome for this particular element challenging and had its limitations. And then participatory educational activities. Some of the regions had a lot more people sign up. They would do outreach in different ways, and measuring participation quantity and the variations that occurred there did make it a little more challenging. And then another thing that was cited was just the ACCN and the leadership, and how it was inconsistent, and how the communication was bad, and just all these things that we've already been talking about, but at the leadership level within the program itself. And then problem standardizing, strength of community partnerships. So there's a lot of problems in this task, and they really are trying to do the best that they can. And the next question: what are the types of evaluation identified in the ACCN article? So you have types of evaluation: formative evaluation, which increase the program effectiveness from making changes in the program directly, the development of that program, looking at the process, the protocols, how things are implemented, and making sure there's consistency between the plan, the process, the program, all these things, and that the methodology and the procedures are both, they have a high quality level and they have a certain number of them as well, that are being all done at each of the locations. So the same number of evaluation measures, methodologies done at each of the locations. Very effective in guiding program delivery, the process of doing process evaluation, and it really allows for mid-course corrections where you can change things halfway through. It does limit your research because you're not getting all of the information. It's not consistent as you move through time. You kind of have to restart a little bit, but it does allow you to make those changes so that you're not doing something that's ineffective. And some of the process that they had, phone interviews, review of documents, and different records. And then looking at outcome evaluations, measuring level of effectiveness of achievement, presenting information to justify the program, to get additional funding, really just trying to figure out how good this program is so that they can use that information to replicate it and continue it and generalize the results so that other people can enjoy those same benefits that are in similar geographic regions under similar circumstances. All right, so what are the two pitfalls of large government program evaluations? The article identified that we often, when we're doing evaluation work, we focus too much on design rigor and too much on experimental designs, which doesn't make sense. I think we want to do that. But the reality is that problems are going to happen, and we should expect those problems to happen. So problem solving along the way to improve design is essential, and really using any feedback that we can, and recognizing that that is useful feedback, even if it's not ideal or not what we want. And there really is no ideal evaluation study. Whether it's possible or not is very challenging just by the nature of what it is. The other fall, focusing on the immediate question and not the big picture, not looking how we contribute to social theory, how we can contribute to the social sciences, and our understanding of the macro picture here. And the other question, policy formation, both at all of the program, the agency, organization, and the legislative levels. So key takeaway: be creative when we're evaluating programs for effectiveness across all the different evaluation approaches, types that we've been discussing, and looking for the usefulness of program evaluations and how they are subjective, and there are no ideal programs, and even poorly designed programs can offer some sort of valuable feedback, and trying to figure out what that feedback is, so that we can be more effective in the future in accomplishing our goals. All right. Ben, hope you all are doing well. I hope you're staying well and safe and all that stuff and not going too crazy yet, wherever you are. So hopefully we get to see each other again. But if not, it's been fun.